Welcome to our channel. In this video, we will talk about late pregnancy. Please click the first link in the description to discover one weird tip to reverse infertility and get pregnant naturally in just 60 days. Getting pregnant after 35. Late pregnancy, for many, would be the result of a handful of women getting pregnant after 35 years. In fact, and as everyone knows, any woman is able to procreate until the fateful date of menopause. This is why, currently, the phenomenon of late pregnancy affects more and more women, after 38 to 40 years and sometimes even up to 45 years and over. The causes. Among the most common causes of late pregnancy, the most obvious is a woman's delay in entering the workforce. These take longer to settle in their post, which delays the time to have a baby. The difficulty also in meeting and maintaining the stability of a flow also explains the many late pregnancies observed. Another element that may explain the higher frequency of late pregnancies, the use of assisted reproduction techniques or assisted reproduction techniques. And yes, because it is indeed the actresses of all Hollywood who started the debate around late pregnancies. Many have experienced pregnancy after 40 years. To name a few, Halle Berry, 46 years old, Carla Bruni Sarkozy, 43 years old, Nicole Kidman, Salma Hayek, Madonna, Celine Dion, Marcia Cross. The oldest mother known to date is none other than an Indian who gave birth in 2008 at the age of 70. Natural or not, these late pregnancies make all women want normal, right? The risks of pregnancy after 40. Pregnancy after 40, in particular, involves risks that should be borne in mind. As much as fashion magazines love these stories about babies after 40, we can't downplay them medically. Any late pregnancy is therefore subject to very specific monitoring. Why? Quite simply, because being pregnant after 40 years of age, we have a higher risk, for example, of having pregnancy hypertension. A disease is rich in consequences: preeclampsia, placental abruption, underweight or overweight babies, nervous or cardiac malformations. Late pregnancy can also be responsible for the occurrence of gestational diabetes, cardiovascular concerns, the appearance of fibroids in the uterus, cases of trisomy 21, premature delivery, or miscarriages. However, faced with such risks, medicine in France provides for several examinations such as amniocentesis, the dosage of serum markers, and ultrasound at 12 weeks to measure nuchal translucency. Some mothers who have given birth late also mention the difficulty in recovering from childbirth and then after childbirth. More tired than at age 30, many find it difficult to cope with the first weeks of a baby's life. The benefits of a late pregnancy. Having a baby after 35 to 40 certainly involves risks but is also sometimes advantageous. The mother has matured, especially if she has already had an experience with other children. From a financial point of view, the means are often more important and guarantee better comfort for the newcomer. On the mental level, the 40-year-old mother thus offers herself a new youth, which does not displease those around her.